Imagine Anne, who is a single mother of two children, one who's about to go to college and the other who's an infant. One day, she discovers something abnormal on her breast. Concerned, she goes to the oncologist. After running a series of tests, the oncologist tells her the unfortunate news that she has breast cancer and that she has to undergo chemotherapy. Anne goes through chemotherapy for 18 weeks, only to realize that the treatment was ineffective. With her insurance not paying enough and other additional costs imposed on her, Anne had to go through her meager savings that was originally intended to pay for her child's college tuition and childcare needs. She also had to go through the unnecessary side effects of chemotherapy. Now, her only option is to change her chemotherapy regimen or go directly to surgery. So we at Opticom are here to address this ongoing issue of monitoring the effectiveness of chemotherapy over time, so that patients do not have to undergo the pain and suffering caused by drugs that are not working. The oncologist will therefore be able to tell if certain drugs are working or not in as little as one day, and therefore take the necessary action.
I'm tired of delivering the same tragic message over and over again. Your chemotherapy didn't work. Our standard of care for monitoring chemotherapy has remained stagnant over time. We use palpation. I use my hand and check the stiffness of the tumor. It can take us 18 weeks to find out whether or not chemotherapy works. Can you imagine what the patient has to deal with during that time? There's horrible side effects for chemotherapy: nausea, vomiting, diarrhea, and a number of systemic effects that depend on what type of drug the patient is getting. I envision a device that's affordable, accurate, and non-invasive to solve this problem. But maybe I'm asking for too much. So could you tell me a little bit about OncoSpect?
Of course. So OncoSpect is a portable medical device that can be used to track the metabolic properties of tissue. And from our research, what we found is tumors correlate with increased hydration content and decreased lipid content. And we can quantify those attributes into an index based on our optical technologies. And this can be used to track chemotherapy progress over a period of time.
Wow, that's really useful information. So how does OncoSpect compare to what I have in the clinic right now?
So unlike MRI, OncoSpect can be used over and over again since there are no side effects. So we don't use contrast dyes. And unlike palpation, it has more functionality, it gives more information overall to oncologists, and we can do all of this without compromising patient comfort and costs.
Oh, very neat. So this is really interesting. Is there a prototype or something I can see?
Well, we do have a video demonstration showing how our device works.
Cool. Well, let's take a look.
Here is the box for the diffuse optical spectroscopy unit. Now notice the optical fiber and wire coming out of the unit. These lead to the probe, which contains the detector that is used to take measurements along the breast. To demonstrate how this device will be used on patients, a breast phantom is used as a substitute for a breast in this video. On the breast phantom is a grid which is used to construct a 2D image from the 1D readings. Now notice how the user takes measurements along each point on the breast phantom. This is important for constructing a 2D map, which will be seen later on in the footage. Upon exporting the data taken from the OncoSpect unit, the user will use a pre-written MATLAB script in order to analyze the data. This will form a 2D image map as shown in the footage. Using these images, the oncologist can determine the metabolic activity of the tumor. This will allow the oncologist to determine how the patient should proceed with chemotherapy treatment.
So as you can see, our device is easy to use, it involves little or to no patient discomfort, and it gives useful information for oncologists to use.
Wow, that's really cool. Where do you guys see this going?
That's a great question. So we actually have a video produced by our marketing department that explains this in more detail.
Oh, okay. Let's take a look.
In the US, there are 18,000 active oncologists which we can sell our device to. This will allow oncologists to treat the 50,000 addressable breast cancer cases. And with 250,000 additional breast cancer cases in the US, there's definitely a market worth addressing. We hope to expand our market by targeting head and shoulder cancer cases as well as other metastatic diseases.
I would say, Preston, I'm very impressed. Where can I find OptiSpec?
Well, we are currently in the phase of product development, and we are looking soon to get FDA clearance. And hopefully by then, we'll put our product into the market.
I can't wait.
I'm glad to hear that. So we at Opticom believe in the personal oncology for the benefit of the patients, and with your support and the support of other oncologists, we will relieve the unnecessary suffering of patients.
Of course. Thank you for all your work, and I'm looking forward to OncoSpec.
My pleasure.